Assalamualaikum and good morning, miss. How are you doing today? Do you feel good or do you feel healthy? Or is there any sickness or situation that we must concern about you? So today we will discuss on your current oral conditions, and not just that, I will also demonstrate on how to practice a good oral hygiene practices and also its importance. Also, I will also explain to you the tips to maintain your periodontal health. Are you ready to listen what I want to discuss with you? So first, before we want to know how to take care of our tooth, let's start with anatomy of the tooth, since we must know each the characteristic and part of the tooth. There are two parts of the tooth, which are crown and a root. For the crown part, there are enamel at the outermost area. The middle layer, the layer that located between the pulp and enamel, is called its dentin layer, and pulp is the innermost layer. We also can see gums, the pink area in our mouth when we smile, that separates the crown and the root area. The borderline between the crown and the root area we call as cemento-enamel junction. At the root area, there are structures like cementum, bone, nerves, and blood vessels in the pulp and end opening of the root. So, what we want to know is also the periodontology. Periodontology is actually the study of specialized system of hard tissue, which is bone, and soft tissue, which is gingiva, the pink part in our mouth that supports our teeth, and also the maintained position of the tooth in the maxilla, the upper part area, and the mandible, the lower tooth area. We also call it as the periodontium. So now I will explain to you some of the gum diseases that can happen to us, and also tell you the current gum condition that you have in your mouth today. So the two common gum diseases that are common in Malaysia and also the world globally is gingivitis and periodontitis. You must questioning what is the difference between gingivitis and periodontitis. So the difference between these two, as we can see here, gingivitis is the early or initial stages of gum disease, while periodontitis is the advanced stages if the gingivitis become more severe of gum disease. Gingivitis is a mild form of gum disease when the gum becomes swollen, become red, and also causing the gums to bleed easily while you're brushing or flossing. Have you faced this situation while you're brushing your teeth and you spit your toothpaste? You can see the blood in your sac. If so, the good news is that gingivitis is often reversible with good oral hygiene habits. It means that you need to take care of your oral hygiene very proper. How to do it? So, brushing your teeth regularly, you must do flossing, and getting regular dental checkups can help prevent and treat gingivitis. If gingivitis left untreated, gingivitis also can progress to more serious gum disease, and it's important to take care of your oral health. Periodontitis is a condition that are more advanced and serious form of gum disease that goes beyond the inflammation of the gum seen in gingivitis that I explained just now. In simple terms, it's a condition where the supporting structures of your teeth, including the bone, become damaged over time due to persistent infection and inflammation. Some of the main features of periodontitis is loosening of teeth. It means your teeth become more mobile. What we gonna do when we want to examine your teeth is loose or not is by try to push the tooth front and forth and back to see if the tooth is easily mobile, and exposure of the root surfaces. In periodontitis, the inflammation extends deeper into the supporting structures around your teeth. This causes the gums to pull away from the teeth and forming pockets that can collect debris and bacteria. This debris comes from your food, comes from your drink, and also plaque build up in your mouth. As the infection worsens, the body's natural response, along with the toxin produced by the bacteria, begins to break down the bone and connective tissues that hold your teeth in place. As the bone tissues weaken, teeth may become loose and in severe cases even fall out. You want to lose your teeth? Not right? So we must take care of our periodontal health and also good oral hygiene. Additionally, periodontitis also can lead to other complications such as receding gums, changes in the way your teeth fit together when you bite, and in some instances contribute to systemic health problems like heart disease or diabetes. So, what actually the main culprit of gum disease? The main culprit of gum disease is the plaque bacteria. And what is plaque bacteria? Let's break down the concept of plaque bacteria in the simple terms. So, imagine your mouth is a city where there are bacteria live and work. The bacteria, we can also imagine it as a human being, as us, and these bacteria are essential for various functions. But just likely any city in this world, they can also create waste like us. So in your mouth, this waste can be called as a plaque. Plaque is a like sticky film that coats your teeth. It's made up of leftover food particles, as I said just now, saliva, and most importantly, bacteria that adhere and helps the adhesion of the plaque on the tooth surfaces. Now, these bacteria are not all bad, but some of them can cause trouble when you eat. The bacteria is a plaque feast on the sugars and the carbohydrates in your food. As they dine, they produce acid that can harm your teeth and irritate your gums. Over time, this can lead to inflammation and irritation of your gums known as gingivitis. It's like the bacteria starting a small protest in your gums, and it makes your gum inflame, it makes your gum swollen and easy to bleed when you brush or you do flossing in your daily basis. Since you claim that you have diabetes type 2 with HbA1c level 6.8%, which indicates you have diabetes and your stress score is 6/10, these two factors can be a good risk factor and reasons why you have gum disease in your mouth today. Some other factors that you might want to know that also can affect your gum condition is a poor oral care habit, smoking, and dry mouth. And thankfully, these three factors is not associated with you since you are non-smoker and you can stabilize your diabetes and stress level on your daily basis. So, this is the picture of your current oral condition, which is the OPG X-ray that we taken just now. From this picture, we can see there is generalized plaque surrounding your gum area of your teeth and also the interdental space. Almost all of your teeth surrounded by plaque. We can see the white patch in your CEJ area. I mean the area, the lower area of your tooth, and this might be due to improper brushing technique. Let's focus on your gum on the other story. The gum shows the initial symptoms of redness and swelling of the gum. It had diminished or become less noticeable. There are few reasons why this happened. First of all is tissue destruction. Severe tissue and bone loss can occur, leading to formation of deep pockets around the tooth. These pockets may trap debris, making it challenging to notice visible signs, and it also helps the debris to accumulate more aggressively in the flapping of the gum, and it then will cause a redness and swelling on the surface. So, the chronic inflammation of the gum, in simple terms, is a long-lasting response by the body's immune system to something harmful, like an infection or injury sometimes lead to a state where the gums appear less visibly inflamed on the surface, but the damage is ongoing beneath the gum line is very severe and is irreversible. From this picture also, we can spot multiple cavitated lesions, or we call it caries, at the occlusal surface of upper and the lower back of the tooth. These caries happen to the presence of plaque bacteria. These bacteria produce acids and attacks the tooth and lead to tooth decay. Factors such as poor oral hygiene, inadequate dental care, and a diet high in sugars and carbohydrates can contribute to the development of dental caries. There are also some spaces, but it is not very noticeable since it is involving the posterior tooth in your mouth. The tooth becomes spacing due to extractions of two lower molars or posterior tooth, which are tooth 3-8 and tooth 4-7. Then, when I do a periodontal pocket shutting to know your current gum conditions, first, what we need to do is we measure your pocket depth. It is the depth of measurement of the space of pocket between your teeth and gums. Most of your teeth has high or deep pocket depth of 5 to 8 millimeter. Some of your teeth have fluid exposure, especially at the lower teeth, and exposed area is about 2 to 3 mm, which is quite high and concerning. Furcation involvement at your upper teeth and also mobile your bleeding score, and the plaque score is quite worrying and also can lead to periodontitis and also gingivitis. Other than that, we also did an OPG to assess your bone level. From this x-ray, we can see the red line which I draw indicates that where your normal bone should attach, while the yellow line indicates your current bone level. At your upper jaw or the maxillary area, there is reduced bone level, or we call as bone resorption, at almost all the area, but it is prominent at the area of anterior teeth and molars, where the bone resorption extending to middle part of the root at your lower jaw. At your lower jaw, there is also reduced bone level, or we call as bone resorption, at almost all the area, but it's more prominent at the area of anterior teeth and molars, where the bone resorption extending to middle part of the root. As you can see in the x-ray, there is more blackish colors surround the 3-8 and 4-7 teeth, which indicates bone loss or bone resorption due to your extractions. From all this assessment, we can conclude that you are currently at grade 3 periodontitis, and there is a bone and tooth loss, deep periodontal pocket, and furcation involvement. So, after knowing your current gum condition, you must wondering what is the characteristic and how to differentiate the healthy gums, the stage 1 periodontitis, and also the next stage, which is gingivitis and periodontitis. So healthy gums characteristic, which is gums are pink, firm, and fit snugly around the teeth. No signs of bleeding or discomfort during brushing and flossing. Gingivitis, on the other hand, when the gums become red, swollen, and may bleed easily, especially when brushing. This is the early stage and it's reversible with the proper oral care, as I mentioned just now. Mild periodontitis, or we call as stage 1, if gingivitis progresses, it can lead to mild periodontitis. This involves the inflammation spreading to the supporting structures of the teeth, and there may be some bone loss, but it's usually reversible with professional treatment and improved home care. Second stage is moderate periodontitis. At this stage, there is more noticeable damage, including deeper pockets between teeth and gums. Professional interventions becomes crucial to prevent further progression. The next stage is severe periodontitis, and it can lead to which is severe periodontitis. Significant bone loss occurs and teeth may start to feel loose and mobile very easily. The treatment becomes more complex and may involve procedure to restore and stabilize the affected areas. It's essential to catch any signs early and maintain good oral hygiene to prevent progression into the severe stages. So next, we must get to know why plaque control is important. Plaque control is important to prevent cavities. Plaque is a major contributor to tooth decay that will lead to formation of cavities in our tooth. By controlling plaque, we will reduce the risk of acid produced by bacteria damaging our tooth enamel. Next is to protect the gums. The plaque buildup can lead to gum inflammation and disease. Proper plaque control will help to prevent gingivitis and more severe forms of gum disease such as periodontitis, maintaining the health of our gums. Next, it will freshen breath. Bacteria in plaque can produce compounds that cause bad breath. By controlling our plaque properly, it will help our keep to maintain fresher in our daily life. Next, it needs to preserve tooth structure. Over time, untreated plaque can harden into tartar, which can only be removed by a dentist. Regular plaque control prevents tartar buildup and preserves the integrity of our teeth. Next, we must get to know the oral hygiene aids in order to have a proper oral hygiene in our daily basis. as a daily routine. Oral hygiene aids are tools that help keep your teeth and gums healthy and prevent tooth decay and gum disease. Some common oral hygiene aids included toothbrushes. Dentists recommend using a soft bristle toothbrush and brushing twice a day, and electric toothbrushes are also recommended because it is more efficient than manual toothbrushes. Next is a dental floss. Floss at least twice a day after brushing to remove food particles and plaque. Flossing too vigorously can also damage your gums that will lead to irreversible damage to our gum. Next is interdental brush. A dentist may recommend using miniature brushes called interdental brushes or cleaners in addition to dental floss to remove any plaque buildup in our mouth. Next is oral irrigator or mouthwash. We need to use an oral irrigator to remove food particles from our tooth that are not dislodged by brushing or flossing. Oral irrigators don't replace brushing and flossing because they don't remove plaque. So you always need to brushing and flossing in your proper oral hygiene routine. Next is a tongue cleaner. Use a tongue cleaner to remove bacteria, fungi, and food debris from the tongue. And you also can use tongue scraper from a plastic and metal due to your own preferences. Last but not least, use an antimicrobial mouth rinse or a mouth rinse containing fluoride to promote oral health. So let's get started on how to brush our teeth in the correct way. First of all, we must choose the correct toothbrush. Use a soft bristle toothbrush with a small head to reach all areas of your mouth. Second of all is apply the right amount of toothpaste. Use a pea-sized amount of fluoride toothpaste and pour it over our toothbrush. Next is we must follow the steps for proper brushing to get the optimum result. First of all, we must position the brush correctly. Hold the brush at 45-degree angle to your gum line, and the bristle should be in contact with both teeth and gums. Use gentle circular motions and gently move the brush in small circular motions and avoid scraping too hard as this can damage your gums and enamel. Clean each teeth thoroughly and focus on cleaning one or two teeth only at a one time. Brush the outer surface, brush also the inner surface and chewing surface of all teeth. Step 4 is clean behind the front teeth. How to do it is tilt the brush vertically and use up and down strokes to clean the back of your front teeth, such as this. And for the anterior lower teeth, you can also tilt the brush vertically and use up and down strokes to clean the back of our anterior teeth. Last but not least, we must brush our tongue using tongue scraper. Gently brush your tongue from back to front to remove bacteria and freshen your breath. What we need to remember is timing is key during our proper oral hygiene routine. Brush for at least 2 minutes twice a day, morning and before bed. After completing our toothbrushing routine, we must rinse our mouth and toothbrush thoroughly after brushing and store the toothbrush upright in an open container to air dry. Next, let's discover on how to do flossing. Choose the right floss. Use wax or unwaxed floss, dental tape, or floss picks based on your preference and dental needs. Then we must follow the steps for proper flossing. So these are the proper steps for proper flossing. First of all, take the right amount of floss, pull about 18 inches of floss, and wrap most of the floss around your middle fingers, leaving about 1 to 2 inches to work with. So hold the floss correctly and use your thumb and index finger to guide the floss and keep it taut. In the step 3, insert the floss gently. Insert the floss gently. Slide the floss gently between your teeth using a sawing motion, like a chainsaw cutting a tree, and avoid snapping it as this can injure your gums. It means that you must not pull the floss very hard to your gum as this can lead to serious gum condition. Then we need to form a C shape. Curve the floss around the side of one tooth, forming a C shape. And gently slide the floss up and down around the tooth and making sure to go slightly below the gum line. And don't worry, it doesn't hurt your gum. And repeat for each tooth and use a clean section of floss for each tooth. It means don't repeat the area of the floss that already dirty in the other tooth. And don't forget to floss the back sides of your last molar. If your wisdom tooth is unerupted, it means that in your last molar is tooth 47, 37, 17, or 27, you must also floss in that area. After flossing, rinse your mouth with water or mouthwash to remove loosened debris. Discard used floss and never reuse floss as it may harbor bacteria. And one thing to mention, when you flossing, make sure to pull it to the front to remove the debris. Next, we will go through on how to have a correct interdental brushing technique other than flossing technique. First of all, we must choose the right interdental brush. Have any size that you can buy in any store nearest, and you may need different size for different areas of the mouth. First of all, we must hold the brush firmly. So I will demonstrate on how to hold the brush. In this interdental brush, there is a handle that grip, and make sure you hold the gripping area and ensure that you have a comfortable hold. Next, insert the brush gently in the interdental area. Insert the brush gently between your teeth and the gum line. Avoid forcing it as this may damage your gums. Move the brush in and out of the space between your teeth a few times until you make sure it is clean. And ensure the bristles make contact with the tooth surfaces to remove plaque and debris. Step 4 is repeat for all interdental space from the most posterior tooth to most anterior tooth and repeat in each quadrant. Clean all spaces between your teeth, including around dental work, which is crowns, bridges, and abutment. Since we have bridges here, so just push the interdental brush in and clean it until there is no debris remaining. So rinse. After using it, rinse the brush under the running water and remove debris after using it. After interdental brushing, rinse your mouth with water or mouthwash to remove any dislodged blood or food particles. Store the brush in a clean and dry place. Replace it when bristles become worn or frayed, usually every 1 to 2 weeks after starting using the new interdental brushes. Next, we will go through on how to do a mouthwash. First, we need to choose the right mouthwash. Select a mouthwash based on your oral health needs. First, fluoride mouthwash for cavity prevention, antibacterial mouthwash to reduce plaque and gingivitis, alcohol-free mouthwash if you have sensitive tissue or dry mouth. Follow the steps for proper mouthwashing. Step 1. Measure the mouthwash and pour the recommended amount, usually 10 to 15 ml or as indicated on the label, into the cup. Next, swish the mouthwash. Take the mouthwash into your mouth and swish it around for 30 seconds to 1 minute. Move it through all areas and gargle in your mouth, between your teeth, over the gum line, and around your cheeks and also tongues. Step 3 is, as I mentioned just now, is gargle. It is an optional step, and tilt your head back slightly and gargle the mouthwash for a few seconds to clean the back of your throat. Step 4, spit out the mouthwash and remember and do not swallow it and spit it to the sink after the recommended time. After do mouthwashing, avoid eating, drinking, or rinsing your mouth with water for at least 30 minutes to let the mouthwash work effectively. Periodontal treatment that will be provided for you, miss, is a plaque scoring, and it is important to observe the improvement of your plaque score. Thus, there will be several appointments needed to see the change of your oral hygiene. We also expect for your plaque score to reduce throughout the follow-up. routine. So what we're going to do in plug scoring is we will use a disclosing tablet and count the surface area of your tooth that have a plug, and we will measure the percentage of the plug score. Next is do scaling and root planing. Scaling is a process by which plaque and calculus are removed from both supra and subgingival tooth surface, while root planing or root debridement is process by which residual embedded calculus and a portion of cementum are removed from the root to produce smooth, hard, and clean surface. And also, there will also have several review visits such as compliance review 2 weeks after scaling and root debridement, full periodontal review 6 to 8 weeks after scaling and root debridement, and we hope to expect reduction in plaque score, bleeding score, and pocket depth in your oral cavity. After dose treatment, you need to expect that you may face tooth sensitivity, and some individuals may experience increased tooth sensitivity, especially too hot or too cold temperatures after scaling and root debridement. This sensitivity is often temporary and can be managed with desensitizing toothpaste or other products recommended by your dentist, such as Sensodyne. Next is gum discomfort or bleeding. It's normal to experience mild discomfort of bleeding of the gums after scaling, particularly if there was significant plaque and tartar buildup. This usually resolves within a few days. Regular gentle brushing and flossing as advised by your dentist can help alleviate this. Swelling and discomfort also is a common post-routine, post-treatment symptoms after you do scaling and root debridement. Swelling of the gums may occur, particularly if the procedure involves deep cleaning below the gum line. Applying ice packs as directed by your dentist can help reduce swelling, and any discomfort can often be managed with over-the-counter pain medications. Last but not least is the loose teeth. In some cases, teeth may feel slightly loose after scaling and root debridement when your tartar buildup is too thick and it causes your gum line to recess below the normal level, and your teeth cannot be held in its position properly. Your teeth should be stabilized as the supporting structures heal, but if the tartar buildup is too thick, it may be irreversible periodontitis. And last is exposure of sensitive root surfaces. If the procedure involves cleaning near the roots of the teeth, you may experience exposure of sensitive root surfaces, as these can lead to temporary sensitivity, but it should improve over time by using desensitizing technique. That's all. Thank you for listening.